Hey everyone, this is Vignesh from VNMU. Today we are going to see about hepatic portal system. So today we'll see the anatomy of the hepatic portal system, the functions of the hepatic portal system, and the clinical aspects which are related to the hepatic portal system. So hepatic, which is mean liver. The portal means the portal vein, the system. So the hepatic portal system, the veins which arises from the gastrointestinal tract, spleen, pancreas, gallbladder, and also the umbilicus, the veins of a lesser omentum, which will drain into the liver. From the liver, via inferior vena cava, it's go to the heart. So today we'll see the hepatic portal system. What are the contents which present in the hepatic portal system, and what is meant by the accessory hepatic portal system. So the veins which arises from spleen, pancreas, gastrointestinal tract, and also from umbilicus, the veins of a lesser omentum, which will drain into the livers. So when you see the liver and the stomach, there is a connection between liver and the stomach. So we already saw the muscle to muscle connection is done by with the help of a ligament. So in between the connection between liver and stomach, we have a ligament called the hepatoduodenal ligament. We have hepatoduodenal ligament. The hepatic means liver, duodenal the part which present in the stomach, the small intestine, which joins from liver to duodenal. This is called hepatoduodenal ligament. In the ligament, there is a presence of three content. So we have hepatic artery, hepatic vein, that is a portal vein, and then cystic duct, which arises from the gallbladder. So in the hepatoduodenal ligament, we have a three content: hepatic artery, hepatic vein, and cystic duct. In the cystic duct, there is a presence of cystic vein, which arises from the gallbladder, which is then drained into the liver. So we'll see where it is arises from and how it's drained into the liver. So it arises from mesenteric vein. We have a superior mesenteric vein, inferior mesenteric vein. So this is a superior mesenteric vein and this is an inferior mesenteric vein. So this superior mesenteric vein, the veins which arises from, so first of all we will draw the colon. So this is the ascending colon, this is the transverse colon, and this is a descending colon, this is a sigmoid colon, and this is a cecum. So this superior mesenteric vein, the veins which arises from small intestine, this ascending colon, cecum, and also middle colon. So middle colon, it means the junction between ascending colon and the transverse colon. So this superior mesenteric vein, the veins which arises from ascending colon, middle colon, cecum, and also small intestine. The inferior mesenteric veins, the veins which arises from transverse colon, descending colon. So the superior mesenteric vein, the veins which arises from transverse colon and descending colon. So which will then go in the upward manner, and then we have one more vein which joins with this vein. So the vein which arises from spleen, which is called splenic vein, and it goes along in the upward manner, and then we have one more vein will join into this system, which is called gastric vein. So this gastric vein, which is divided into right and left gastric veins. So gastric veins to stomach. So these veins which coming from the stomach, and then it will go long in the upward manner, and one more vein which will join into this system, which is called pyloric vein. The pyloric vein which arises from the stomach, the pyloric part of a stomach. We have three parts in the stomach. So from the parts, the pyloric part of a stomach, and then which is drained into the which is drained into liver. In liver, which is then have a minute branches. So superior and mesenteric vein, splenic vein, gastric vein, and then pyloric vein, and then which is drained into the liver. So when you turn back the liver, when you look out the liver from the posterior aspect, so when you see the liver, the posterior aspect, we have a thick like a septum, which will divide the liver into two lobes. That thing is called ligament, which is called a round ligament or a falciparum ligament. So in this ligament, we have veins which enter into this ligament, which is called para-umbilical ligament, and veins from a lesser momentum. So from the umbilicus, this is umbilicus. In a umbilicus, we have a minute tiny branches of a vessels, which is then joins and make para-umbilicus, which will go like this, and it make rotate, and it will then drain into the liver. So from umbilicus we have a tiny minute branches of vessels, and which is then make the para-umbilical vein. The para-umbilical vein which goes to the liver in the posterior aspect, which make loop the round ligament, the falciparum ligament, which is then drained into the liver. Along with this para-umbilical veins, we have veins which coming from the lesser momentum, the veins in the lesser momentum and para-umbilicus vein. So these veins not joined with this portal vein. So this vein is not joined with this portal system. So this vein is directly drained into the liver. They didn't join with this portal vein. This vein is called as a portal vein. So they didn't join with this any of the branch of the tree. So this vein is directly drained into the liver in the posterior manner of the liver. So this system is called as a accessory hepatic portal system. This accessory hepatic portal system, which have a para-umbilical vein which arises from the umbilicus, and veins which arises from a lesser momentum. So this system is called as a accessory hepatic portal system, para-umbilical vein, falciparum ligament, and veins in the lesser momentum. So in the posterior manner we have so I'm going to draw in a dotted line. The vein which arises from the umbilicus. So that one is called as para-umbilical veins. So once again I will write the names and we'll see the overall. So this is superior mesenteric vein, inferior mesenteric vein. Superior mesenteric vein which arises from the ascending colon and middle colon, small intestine and cecum. Inferior mesenteric vein, transverse colon, descending colon. And then this one is a splenic vein which arises from the spleen, and this one is a gastric vein which is then divided into right gastric vein, left gastric vein which arises in the stomach, and then we have a pyloric vein which arises in the pyloric part of the stomach, and this full system is called as a portal vein. And in the posterior manner we have a para umbilical vein, which arises from the umbilicus, and veins in lesser omentum, and we have cystic duct, the vein which arises from the gallbladder, which is then drained into liver. So this system, the paraumbilical vein, veins in a lesser omentum, cystic duct, and the falciparum ligament which is present in the posterior aspect of the liver, which is called as a accessory hepatic portal system. Accessory hepatic portal system. So this portal vein, when it is drained into the liver, which has a tiny branches, now we'll see what it will look like when you see in the microscope. The microscopic view of the portal vein inside the liver. So I'm going to take out a single cell of liver which is called a hepatocyte. When you look out in a microscope, it will look like a benzene ring. So you can say it also a hexagonal shaped. When you see in a microscope, it will look like a benzene ring, hexagonal shape. This portal vein which is drained into your liver, which has a tiny branches, it will when we look out in the microscope, the hepatocyte cell which has a interlobular vein and then sublobular vein. So interlobular vein, this, so look out, think it as a portal vein. So this portal vein which is drained into a liver, the hepatocyte cell, which has a minute branches which is called interlobular vein, and then sublobular vein, and then which is drained into a area called central vein, which is called central vein. Portal vein which will enter into a hepatocyte cell, and then interlobular vein, sublobular vein, and then which is drained into central vein. So we saw what is a portal vein, the tree, the branchial tree, and we saw accessory hepatic portal system, and then we saw what is a central vein, the microscopic view of hepatocyte cell, and then the functions of hepatoportal system. So when we eat or when we take any drugs, after it digest, after it it gone to the small intestine, after it did all process in the small intestine. So after that it absorbed in the blood. When it is absorbed in the blood, first mainly it will go to the liver, because liver is called as a police cell or checkpoint for a blood to check the blood content. So whether it has a toxin, whether this content, the nutrition, the blood content, the absorbed content, which is good or bad for this human body. So this liver cells will check out the content which present in the blood. So it will first enter into the liver cells, and then it will check if it is a toxin, so it will detoxify the toxin. So the liver cell, it is detoxifying the toxin material, and then it filtrating the blood content, and blood content, if it is a toxic or it contains any infectious cells, so it filtrating the content. So and then it eliminating the toxins or any other thing which bad to our body and bad to our cell. So this is a main concept, main physiological functions which are related to the hepatic portal system: the detoxifying, filtrating, and eliminating the bad things which present in the blood content after absorbed. First, the blood after absorbed, mainly first it enter only to the liver cells to check out the blood. So also we have many other functions like it is a synthesis of a blood clotting factors and some others so on. So mainly which are related to the hepatic portal systems are detoxifying, filtrating, and eliminating. After then, after this blood is normal or it detoxified or it filtered, after that it will go to the heart via inferior vena cava to the heart, and then it will go to the circulatory system. So the clinical aspects which are related to the hepatic portal system, mainly we have a portal hypertension. The hepatic portal hypertensions, the portal hypertension. Normally 5 to 10 mm of Hg. The portal pressure, this portal vein pressure is about 5 to 10 mm of Hg. When there is increasing of a venous blood flow to the portal vein, if it is increased about 10 mm of Hg, so it's lead to portal hypertension and it's lead to a liver cirrhosis. That is a fat accumulation in the liver cell, in the liver. So when there is an increasing of a portal hypertension, it lead to a damage to the hepatocyte cell. So when there is a damage to the hepatocyte cell, it's stopping the functions. So it stop the detoxifying. So it's stopping the filtrating function. It's stopping the eliminating functions. So it's lead to the accumulation of fat in the liver cells. So and also in alcoholic, the repeating drinking of alcohol. So alcohol is a toxic to our body. So when it is absorbed in the blood, it go to the liver. In the liver, it is repeating detoxifying that toxic material. So when there is a repeating manner, so in certain situation, so these hepatocyte cells is damaged or stopping their functions. So it's lead to stopping the detoxifying function, the eliminating function, and filtrating functions. So it's lead to a liver cirrhosis, fat accumulation in the liver. So mainly portal hypertension, liver cirrhosis, and any other infections which are present in the portal vein. So it will lead to disturbance in the hepatic portal system. So these are the clinical aspects which are related to the hepatic portal system. So this is all about hepatic portal systems. So thanks for watching. We'll continue to some other topics in some other videos.